Welcome and thanks for pressing play. This episode of WarDocs was made possible by a partnership with the Defense Strategies Institute's OP Med TV and was recorded at the 2024 Operational Medicine Symposium in San Antonio. These interviews focus on optimizing military medicine through the modernization and implementation of policies, education, training, research, and development. We also explore emerging technologies to enhance the health, strength, and survivability of warfighters. Welcome to this special episode of WarDocs in collaboration with OP Med TV. I'm your host, Dr. Doug Soderdahl, retired Army urologist, and I'm joined today by Dr. Byron Hepburn. He's a retired Major General from the Air Force and currently is the director of the Military Health Institute at UT Health San Antonio. Byron, thanks for being with us today.
It's a pleasure to be with you all.
So
virtually as well.
Yeah, so interesting. You're part of this Military Health Institute here in San Antonio, and I know that hasn't been around for decades, and you were part of kind of that from the beginning. Tell us a little bit about what you guys do. What is the mission of the Military Health Institute?
Well, our university has a rich tradition of partnering with the military and the VA. It's 50 years in the making, if you will, but over the last 10 years, we've formalized the Military Health Institute to enhance our collaboration with the military and the VA. A lot of our faculty and our students too are former military, and some are in the Guard and Reserve still serving, so it's in our DNA to focus on this mission. And our mission really is to enhance the collaboration in research, in education, and clinical care, and with the broader community as well.
So do you have any examples of what kind of collaboration you're doing specifically in research or education?
Yeah, our big rocks, our strengths are really in trauma research. Many of you know that San Antonio has the only integrated level 1 trauma system, military, civil, in the United States.
Right.
So with that synergy is very powerful. It's powerful for clinical care, it's powerful for education and training for our personnel, and also third and probably even number one is research that goes with that. So that's a great example of one of our strengths. We have a number of other strengths in our university, one of which Dr. Alan Peterson leads a very strong consortium in PTSD, Strong Star. Mm-hmm. And one we're just really getting underway on is a Human Performance Center, collaboration with our sister university, UTSA, and a private research lab at Southwest Research Institute and our military partners. So it's really a lot of great strengths at our university.
So we're currently sitting at the Operational Medicine Symposium in San Antonio, and there's been a lot of things presented. This is day 2 of 2 days. And so what are some of the things that you've been impressed with in the topic of operational medicine? What are your concerns, and where do you think we need to go to be prepared for the next conflict?
Well, Major General Harrell yesterday and our Chief Master Sergeant from the Joint Staff this morning both foot-stomped the evolving threat picture, both globally and domestically, that our military forces are facing and will face. And examples of what's happening in Ukraine, Israel is recent examples, but it is an evolving threat picture. And with those threats come an evolving capability gap for our medical forces, both domestically and internationally. And so we have to meet those and be as proactive as possible. And the fact that we have industry partners here to help solve those capability gaps, these complex problems, is going to be vital in the years ahead.
Now, is there any particular technology that you've seen or heard about that really kind of piques your interest?
Well, I just came out of a lecture a minute ago on burn care. I mean, unfortunately, the Ukrainians have seen horrific burns, particularly from these thermobaric weapons that the Russians are using, and that's just one example, whether they have the bacterial infections, the fungal infections that are very hard to eradicate, just one example of many. The aeromedical evacuation piece is going to be critical too. How do we safely move patients ground, sea, and air in a very threatened environment where we don't have air superiority? And the Ukrainians are having to deal with that right now, having to hold patients for a period of time before they're able to safely move that soldier that's been severely injured.
So most of our experience on active duty in military medicine was during OEF, OAF, the Gulf War, and those conflicts are probably going to be very different from what we see in the future, and you kind of alluded to that. What can we apply from lessons learned from those conflicts that may apply to the next conflict with a peer adversary? And what do we need to be due to learning what's happening currently in Ukraine and Israel about how to prepare for what's next?
I think a lot of it will be, and the chief brought it up this morning, is the resiliency of our medical personnel. We're going to be dealing with higher acuity patients, much more severe injuries, and our volume of casualties is going to be increased. Let's be honest about that. And several speakers have spoken about the fact we're going to have to accept the fact of having to do sincere, really difficult triage. We'll have patients that are expectant. We'll have to deal with that emotionally, physically, and logistically, and do it with honor and integrity. And so those things need to be tended to, which normally medics don't tend to those things. They determine the logisticians to handle those things, but we collectively will need to be looking at that proactively.
Yeah, and that's an interesting point because there's certainly a risk for that moral injury when your capabilities are just overrun and your supply doesn't meet the demand. And I think it's great that the military medicine is being proactive in training this. How do we prepare a nation for that kind of casualty numbers? We haven't seen that since World War II, and that could happen again. How can the nation get prepared for that?
Well, I mean, that's a very good point. And dealing with moral injury applies for a natural disaster here in the United States or in our allies, one of our allied nations, as well as a conflict, a near peer-to-peer conflict. So it is something we have to address the emotional aspects of it. And also, I would say part of that is we forget that about in Afghanistan and Iraq, and it's true in Ukraine as well, or Israel, what's happening in Gaza, a lot of these patients are civilians. They're women and children.
Right.
And half of our hospitals when we were deployed were full of women and children. So we're going to have that mindset too. Take care of the fighting force, preserve the fighting strength, but also have the wherewithal to flex and deal with those type of casualties and injuries and illnesses and infirmities as well.
So tell me a little bit about your personal pathway into Air Force medicine. How did you get interested in the Air Force, and how did you get interested in becoming a doctor in the Air Force?
Well, as a child, I had two dreams of being a pilot and as a doctor, and I've been very blessed to be able to do both those things in my career. I went to the Air Force Academy, had great instruction there, leadership training by some of the premier leaders in the Air Force, and then I had the opportunity to fly fighters, but I decided to go ahead and I went to pilot training, and I had the opportunity to fly hospital planes, air evacuation planes back in the day, and just loved that mission, just became infatuated with that mission, how important it is, and went to our military medical school, did family medicine training, but also became what's called a pilot physician. And back in the 90s, a long time ago, I was assigned to a flight test squadron on a plane called the C-17, which is our workhorse for global air evacuation, and we did all the aeromedical testing on that aircraft for moving critical patients, burn patients, pediatric transport, and so forth. So it was an honor to do that, and I'm so honored to see the work that our teams have prepared that aircraft to serve globally with our allies today around the world, moving patients very safely and effectively. That's a brief summary of a broad career, but later in my career journey, I moved from aviation and medicine over to leadership, and that was an honor to do that, to motivate and focus teams to excel both here domestically and internationally, and so proud of all the work that all our medics and our civilians too, they're a part of our team as well, have done and are doing today.
So you had a front seat view of and involved in the critical care air transport team development, that concept. Right. How would you say the evolution has been from the beginning of your career flying those planes for aeromedical evacuation to our capabilities today?
It's been a phenomenal transformation, if you will. I'm married to an intensive care nurse who was a flight nurse, and when she came into the Air Force, she was told that they would not move critical patients, and she was very capable of doing so. She would often push to exceed those patients on her plane because she knew she could handle them safely and effectively. But that transformation, actually, I need to give a shout out to General Carlton. I hope he's been on this WarDocs.
He's been on the show.
So, I mean, he's one of our forward thinkers in the Air Force, and he really had to push through a lot of firewalls to get that concept established. But these notions of moving critical patients, really, when you look back at the history, it really started with pediatrics, neonatal ECMO.
Right.
Back in the day, out of Wolford Hall here, when it was a level 1 center, they were moving these critical they're critical patients, those little preemies.
Absolutely.
And phenomenal. So we pretty much established the benchmark even back then that you could move with the right training, with the right equipment, and with the right doctrine, you could move critical patients, whether they're a premature child or a burn patient, what have you. And that adult ECMO I'm segueing on now is so vital today. That's one of our specialized teams, is to have the adult ECMO that is saving lives by moving these patients with lung injuries or severe organ injuries back long distances. It's phenomenal.
Yeah, and recently they had a case where they had 2 ECMO patients in a air transport.
It's phenomenal.
It is amazing.
Yeah, and so we have to continue, and I know there's a team here from Knight Aerospace on what they're doing to move patients that are with biohazards, for example.
Right.
That's another, I know, appropriate focus area, that how do we safely move somebody with a hemorrhagic fever from Africa or something, and doing that in a professional way with the right equipment, the right doctrine, and right teams is going to be a vital thing that we can do as well.
So you trained in family medicine, and I think a lot of people, who don't understand military medicine think, oh, all they do is take care of trauma and gunshot wounds and IEDs. But tell us, what is the value of family medicine in the military health system, and what kind of opportunities does a family doc have to serve?
Yeah, when I went to medical school, I really enjoyed, because I was older, and I always thought I'd go into orthopedic surgery, and I was certainly on a pre-internship for that as a 4th year, and I loved it. But I really love the totality of health, and I love the focus on prevention and wellness. Being a pilot and having taken care of pilots, we're all about keeping the guys and gals in the cockpit, in the fight, if I was an Army surgeon or a doctor. And I love the totality of it. I love, when you talk about health and wellness, you have to look at the entire family. When I say family, it could be a nuclear family, a Nazi Harriet family from the 50s, but it can also be an atypical family, a single mom, or an elderly parent taking care of a soldier or a wounded Marine. And so look at that totality for their well-being and care. And the slide deck that was just given a few minutes ago by the Joint Staff Surgeon focused on, we really have to be really concerned appropriately of the health and resiliency of the broader family domestically, home station. There's no way a Special Ops SEAL can be focused in a combat environment if his home environment is the mother or those children is not well cared for, the kid with leukemia is not being well cared for. He or she is not going to have his mind in the game. So it's a vital thing. It's an honor to do it. And there's a great joy in it too. I really enjoy, and they talked about this over and over again, we've got to start taking care of in our military treatment facilities more of our beneficiaries. Hello, we've talked about that for years. We're going full circle now. And when I was a young doctor at the Academy Hospital in the 90s, taking care of World War II veterans, it was an honor to do it. I remember I cared for a former man that had been on the Bataan Death March, for example. And it was a distinct honor to take care of his multiple medical problems from that period of time in his life. And I learned more from him than I gave him probably, but it was a privilege and it was a joy.
Yeah, I had a similar opportunity. I had a patient who was the aide for General Hap Arnold.
Wow.
And had some really interesting stories about life in those days. So yeah, you're right. So that leads me to my next question, is that you stayed in uniform for an entire career, and what is it about military medicine that made you want to stay in uniform, even though if you finished your obligation you could get out? What made you stay?
My philosophy in life is you always get back more than you give. And I was so fortunate to have really good mentors and good commanders that, I can't look back and say there was one that was just toxic. They might have had some personality challenges, but overall they had the mission in heart. They were concerned about the men and women entrusted to their care, and I learned from all of them. And so I had a good career journey in that respect, that I learned a lot. And I also derived great satisfaction out of seeing the teams I had the honor of working with excel in adversity too, in deployed environments. And some of those individuals are lasting friends today. And my wife and I joke about it at our Christmas time. Our refrigerator is just covered with photos, because I'm old school. We still get Christmas cards and photos from friends and families. And those are people that I have deployed with and been with and globally, and that's priceless to me.
So, after your career in the Air Force, you went on with the Military Health Institute. So tell me, how has that continued, that collaboration and that feeling of what you just described about, that teamwork and leadership and that, esprit de corps?
Well, let me just back up. 10 years ago, our university president, Dr. Henrich, was the honorary commander from a medical wing. And we took him over to BAMC, SAMC, and saw the wounded warriors at that time. This is back in 2011-12 timeframe. And he saw the burn patients. He saw the patients at the Center for the Intrepid, and we realized that we needed to have this Military Health Institute, not only to enhance the care for these men and women, but also to make our faculty, students, and staff aware of this patient population, which is significant here in San Antonio. For those of you that are on this net that aren't from San Antonio, we're called Military City USA, and really we're Military Medical City USA because of the preponderance of medical assets here, both clinical and research and educational. So our president wisely thought that we needed to have this focus on educating our future health professionals of all flavors and doing that research and care. And for me to be part of that has been fantastic because I've been able to, or our team has been able to contribute to that mission and vision, but also continue to work with my military colleagues. And there's not a day that doesn't go by that I don't see a colleague that I've deployed with or worked with in uniform of all those branches, to include the Navy here in San Antonio. So it's phenomenal. It's very enriching and enjoyable to see them. And also now, I'm so old, I've seen lieutenants now as 06s and with stars on their shoulders or on their sleeves, and it's a real pleasure and privilege to see them move up as well.
So, on WarDocs, we have some younger listeners, and so maybe even in high school or college, and they're listening because they may be considering a career in military medicine, wherever on the spectrum of medic, corpsman, nurse, doc, anywhere on the team. What advice would you give them about your experience and what they can expect?
Well, I would seize the day, treasure every day you have and the opportunity, and whether you're in the military for 3 years or 30, really take advantage of that. And I would encourage, I understand when certain individuals come into the military and then they transition back to Ohio, wherever they're from, and there's nothing wrong with that, but consider the total force, the Guard and Reserve, because you'll be able to continue to serve, build that camaraderie and toolkit professionally as well, and then also be with your family. But it's a nice combination, and continue to grow and take. When people are giving you opportunities, even though you're reluctant to do so, don't discount them. Jump on them. A lot of opportunities I was given, I was asked to do. And if you knee-jerked your response and said, "No, sir, I really don't care to do that right now. I've got to do this for this," you may miss out on something that's going to be very, very beneficial when you look back on it years later.
We've been speaking with retired Air Force Major General Dr. Byron Hepburn on this special edition of WarDocs in collaboration with Op Med TV. Sir, thanks for your time, and thank you for sharing your insights, and thank you for your service.
Well, thank you from the WarDocs team for what you're doing to get the word out and really moving the art and science of military medicine forward for the years ahead. God bless you guys and gals.
All right. Thanks a lot.
Thank you. Thank you.
Thank you for tuning in to this special episode of WarDocs, made possible by a partnership with the Defense Strategies Institute's Op Med TV. To stay connected with Team WarDocs, visit our website at wardocspodcast.com. Follow us on social media for updates and subscribe to our WarDocs YouTube channel for more engaging content. Your support helps us continue to document the experiences and contributions of military medicine professionals as we honor the legacy and preserve the history of military medicine for the next generation.